In Swahili, Naweza means I can. So we thought that was a great way to name the initiative, because I can means I can live. You know, I can be healthy. I can learn. I can do whatever I want to do. So it's really about patient empowerment and empowering communities, empowering individuals, empowering clinical officers, empowering the system. Hi, I'm Dr. James Ah. I'm the Chief Medical Officer at Medcan, and I'm also one of the founders at Medcan Naweza. I think one of the most powerful things that we learned on the first trip was the importance of active listening. So when I met with the team, I said, really, this is not our country. We're visitors. Let's understand and help first, to seek to understand first before we help. And so I think that was a great lesson from the first trip.
Medcan Naweza's mission is to improve quality and access to care for rural communities in low and middle income countries. It was created in 2013 when Stacey Francis, Dr. Michael Hawks, and Dr. Ah led a group of cross-functional professionals to rural Kenya to visit 2 health clinics. Since that first mission, Medcan Naweza has visited those clinics biannually. One of the greatest health challenges for these communities is non-communicable disease. It's been described as a slow-motion disaster because of its rapid growth in certain regions. In Africa, there's a 27% increase in deaths related to non-communicable disease, projected over the next 10 years. Medcan Naweza is committed to help change those outcomes through continued partnership with community health workers and clinic staff. All funding and support is provided by Medcan.
We've been fortunate. There's been a lot of great successes in a short period of time with this Medcan Naweza project. We've had the M-Mobile Health, we've had a data tracking, we're publishing some research, we've got a team of community health workers, we've got deep relationships with clinical officers. So we really feel that it's got a lot of momentum and there's so much more to do. What's been interesting on this journey is how can Medcan Naweza fit into part of the solution for some of these things. And I think some of the things that we've learned is about empowering communities, empowering the people through knowledge, teaching, and technology, and research has been really a great thing. And the other thing is relationships. Oftentimes you will hear from people, are you coming back? Are you coming back? And so yes, we've been going back. And we go back twice a year, and we go back every 2 weeks virtually. So it's a relationship that you deepen over time, and it's sustainable by believing in the people and empowering them with the tools so they can succeed. The old expression, with power comes responsibility. We're privileged at Medcan to take care of a lot of folks and be an industry leader in what we do. So some of that brain power that we have here with the 400 plus employees and 70 plus doctors, it's great if we can leverage some of that network to people that are in the most desperate situations that have very limited resources. Technology obviously has been a game changer because now we can communicate with these people on an ongoing basis with these ongoing Skype rounds, every 2 weeks. And it's also people are people. Like whether you see them in Bay Street, New York City, or London, or you see them in Kenya, Uganda, people are people. People care about family, doing the right thing, hardworking. So that's the other thing that's been inspiring, is just connecting with sort of that humanity piece. And so that's been amazing and inspiring. It's also kept, I think, our clinicians humble. It's good to lead with gratitude, be grateful for what you have. There's a lot of other folks out there that don't have all the privileges that we do, and we do have a responsibility to try to help out if we can. And so I think Medcan's a great platform to do that.